Good evening, everybody. Thank you for joining us for our May Board of Health meeting. As we mentioned during the last meeting, we're going to make sure that we are having regular meetings with the Board of Health. So I want to welcome everybody and make sure that, that we're here for our active discussion for this meeting. With that said, I'm going to go ahead and call the meeting to order. And the current time is 6:35 p.m. And I want to go ahead and take attendance or roll call. So Dr. Scott McNeil,
Here.
Dr. Marla Gold,
Here.
Dr. Tyra Bryant Stevens. I believe she's not going to be able to attend, correct, Ben?
That's correct.
Great. Dr. Ahmed Ismail,
Here.
Dr. Jennifer Ibrahim. I believe she's unable to attend as well. Is that correct, Ben?
That's correct.
Okay. Dr. Anna Deweese Rao.
Here.
And Dr. Ushma Bilal.
Here.
Wonderful. So have the board members had the opportunity to review the minutes from the February 13th meeting?
Yes.
Are there any questions about those meeting minutes? Do we have a motion?
Move to approve.
Anybody still?
Second.
Great. All in favor of approving the minutes, please say aye.
Aye.
Anyone not in favor of approving the minutes, please say no. Given that we have a quorum, the ayes have it, and the meeting minutes are now approved. With that said, Ben, I'm going to go ahead and turn it over to you. If you can explain the public comment process, and then we'll get started with our one agenda item.
Thank you, Dr. Raval Nelson. There's one member of the public here by my participant list, so I want to go over the public comment process for tonight. If you would like to submit a public comment regarding the business before the board today, you can do so after the presentation of the agenda item that will be heard today by raising your hand, and I will unmute you, or you can send me an email directly to benjamin.hartung. It's benjamin.hartung@phila.gov. And I can read it into the record if you would not like to speak your comment publicly. I will also put this information in the chat function tonight for your review. I will note that the board members will review your comment, but do not have to engage with it during this meeting. And I will want to disclaim that by participating in this meeting, you're agreeing to appearing on the YouTube video that will be posted to the Philadelphia Department of Public Health's channel, because this is a public hearing of record pursuant to Philadelphia Ordinance and the Pennsylvania Sunshine Act. Thank you. Back to you, Dr. Raval Nelson.
Thank you very much. So this evening's agenda, we have one COVID-19 timeframe regulation, and we're focusing on a presentation and engaging in the recession of the COVID-19 regulation. And so we're going to have a presentation from Dr. Shara Epstein, and then we'll have an open discussion with board members, allow for any sort of public comment, and then we'll take a vote. And we'll do just one final housekeeping item that I wanted to make the board aware of, and then we'll conclude the meeting. So that is the gist of the meeting. And so if there are no further kind of comments about the agenda or questions, we'll let Dr. Shara Epstein get started on the presentation. Actually, Ben, would it make sense for us to put up the regulation, the recession section of the regulation, or is that a part of Dr. Epstein's presentation so that the folks can see that? I know the board members got a copy of it.
Yes, I will pull it up after the presentation when we're in the discussion period. but
Great.
I
Thank
can
you.
start sharing my screen now, Shara, if you're ready.
Thank you. Thank you, Dr. Epstein.
And just to confirm, everyone can see my screen.
Yes.
Okay, great.
Ben, do you want to go through the next slide or two? And then we'll
Yes,
go-
sorry.
All right. Thank you all for having me. I'm happy to be here. So we wanted to discuss with you a bit about the last COVID kind of era regulation we currently have, the mandate for healthcare workers to get vaccinated. So I'll talk a little bit about the timeline of that regulation, what the current vaccine requirement is for healthcare workers, and a bit about, I'll reference the recent ACIP meeting regarding the updated COVID vaccine efficacy, current epidemiology, and then we can discuss and open the floor to discussion. Definitely want everyone's thoughts on the potential rescission of this policy at this time. So next slide, Ben. So a bit about the timeline. Way back in August 2021, as we were facing another very, very large wave of COVID that winter, the Board of Health put into place the vaccine required for healthcare personnel and covered higher education individuals. At that time, COVID rate was substantial at 54 cases per 100,000 people per day in Philadelphia, but was on its way up and soon reaching, to reach our peak. It was very important at that time. We were seeing lots of COVID outbreaks among healthcare workers, a huge number of deaths. As you can see, we were at that point at 17,000 hospitalizations and 3,800 COVID-19 deaths. And again, that was to climb that winter. We were in a very, very difficult place. And that's, what we were facing when that regulation was passed. A year later, there were some amendments to that regulation, some relaxation of the mandate for higher education, although it was still in place. And then a few months after that, some exemptions for certain healthcare workers. Again, we were facing another winter with a lot of cases, although less severity that winter, but still, significant numbers of cases. At that point, everyone had access to, primary series of vaccine. Finally, in March of 2023, the higher education component of this vaccine mandate was removed as, we're seeing less severity among younger people. Soon after that, the emergency declaration was ended. And many jurisdictions at that time removed any vaccine requirements. But in Philadelphia, we did decide, you all and the health department decided to wait and make sure that, we really were seeing sustained decreases, and there was not going to be any negative impacts to removing this vaccine requirement from healthcare workers. Next slide, Ben. So a little bit about what the current requirement is. It's important to note, I'm sorry, before I explain this, that PDPH does not require any other vaccines for healthcare workers. We certainly support healthcare institutions in requiring those vaccines. Many institutions require flu vaccine. We're very supportive of that. And we would, of course, support any COVID vaccine requirements among healthcare institutions. So the current requirement hasn't changed since the early days, which is that individual to work in a healthcare institution has to be what at that point we called fully vaccinated. And there was a number of ways to reach that fully vaccinated state, whether it was 2 doses of the initial mRNA Moderna or Pfizer vaccine, 2 doses of an initial Novavax series, a single dose of an initial Janssen vaccine, or, and we've updated this since, a single dose of any updated vaccine. So if you had not gotten that initial series was no longer available as of fall 2023. So you could get a single dose of any updated series to meet the vaccine requirement. There's never been a requirement for anyone to be up to date to meet this vaccine requirement. So we're not, so you just had to have gotten that initial series. And some people may have gotten that initial series back in late 2020, early 2021, and not have gotten any others and be meeting this vaccine requirement. Next slide. So this slide is borrowed from the ACIP presentation on April 15th. Really great presentation by Dr. Fiona Havers, speaking about the efficacy of the current vaccine, or the most recent vaccine, the 2024-2025 mRNA COVID vaccine. And they included 2 studies in here, the VISION study and the IVY study, both studies looking at in this section, looking at hospitalization rate, effectiveness of the vaccine against hospitalization. And this slide particularly is about older adults, immunocompetent older adults over 65. And you can see here, vaccine efficacy was in the 40 to 50% range. Some slight differences based on how long since vaccine, but I think, important to see that having an updated vaccine certainly does prevent hospitalization and death. And again, a very important piece of preventing hospitalization and death for people at risk of severe disease. I wanted to just mention here also the most recent flu vaccine efficacy data, just for comparison, was in a very similar range for hospitalization and death among adults, a little bit lower actually this year. I'm sorry, just about the same. So around 40 to 50% for children and adults to prevent hospitalization with the most recent flu vaccine. Next slide. I wanted to include the slide about immunocompromised adults too, because I think this is really, really important. Immunocompromised older adults over 65 maintain that vaccine efficacy against hospitalization. So with the most recent vaccine, older adults there's a 40% effectiveness of COVID-19 vaccine against hospitalization in older adults who are immunocompromised. I think it's really important to recognize that people have ways that they can and should protect themselves from COVID-19. All right, and then here I wanted to touch on seroprevalence. Again, this is an old study. This is from 2023, so we're 2 years past this now. But at that time, community immunity nationwide was more than 97%. So whether it was from vaccine, from infection, or both, majority from both. So when we first passed the order back in 2021, the immunization and previous vaccination rates were low. Many people hadn't had a chance to get vaccinated for a number of reasons. Again, we had been trying very, very hard to prevent disease. At that time, it was really very important. The healthcare systems were being overwhelmed by patients. And so that was a very different situation. By early 2023, 2 years ago, we were among all age groups and sexes, race ethnicity, higher than 97%, with some seroprevalence higher, closer to 100% in certain groups. And so I think, again, sorry, just to say that vaccine was very essential to protect our patients back then. And I think it was very important that this regulation was passed in 2021. Sorry, we can move on then. All right. Wanted to show a couple epi curves here. So this is counts of hospitalizations. And the arrows here, this arrow is when we, in August 2021, when the vaccine regulation was put into place facing this winter here. And this is when IHE's, institutions of higher education, was dropped from the vaccine regulation. So we can see here hospitalizations have certainly changed. The picture has changed. We still see people hospitalized from COVID. COVID is still something we think about and work towards preventing every day. Our most recent winter surge was the lowest one we've seen ever, and in fact, lower than our most recent fall-summer surge. Nationwide, we had more cases or more hospitalizations back at the end of summer, beginning of fall than we did this winter. And, you know, we're also lower than some of our low points in earlier seasons. Next slide. And then similarly, here are deaths. Again, unfortunately, people continue to die of COVID-19, which is not a matter to take lightly at all. We can see the changes in the curves, and you know, here we are in 2025. Sorry, I realize you can't see my pointer, but much lower death rates than we had seen at any other point in the pandemic, and again, lower than we had seen, you know, at several low points earlier on. I think in summary, I think it's, Ben, you can go to the next slide. Important to just recognize that the picture is different. The rates of hospitalizations and deaths have decreased substantially. Our current winter peak is lower than any previous winter, and we have much more, almost everyone has been exposed and either infected or vaccinated at this point, 5 years into the pandemic. Next slide. I wanted to talk a little bit about, you know, the fact that virus passing a rescission, you know, we still want to protect patients. We still want people to stay up to date with their COVID-19 vaccines, as well as all their other vaccines, of course. PDPH encourages healthcare workers and patients to mask in times of increased respiratory disease transmission. And healthcare institutions should, of course, enforce any existing protocols to protect healthcare workers and patients from all infectious diseases, including respiratory diseases, throughout the year, but particularly in times of you know, increased cases. So with that, I think I'd like to open, you know, the forum to questions. Discuss whether this is the right next move for Philadelphia.
Thank you, Dr. Epstein, for the presentation. I think, Ben, at this point, if you could put up the draft rescission language of this regulation. Essentially, this is a regulation that we've had on the books. Other folks have rescinded theirs, but we've had it on the books, and we'd like the board to review the rescission language and then have a discussion. So Ben, if you could put the regulation up, the draft, please.
Yes, can everybody see my screen?
Yes.
Okay, great. And
Ben,
so
yeah, would you mind reading it aloud? Because I can see your screen, but
yes, I will read it. It's brief, and I will read it aloud to give a brief explanation of what it means. So the board is now considering the rescission of the regulation governing the control and prevention of COVID-19, mandating vaccines for healthcare workers and in higher education, healthcare, and related settings. the text of the proposed rescission reads, the Philadelphia Board of Health emergency regulation governing the control and prevention of COVID-19 mandating vaccines for healthcare workers and in higher education, healthcare and related settings, which was filed with the Department of Records on August 16th, 2021 and amended on August 4th, 2022, October 13th, 2022 and March 9th, 2023 is hereby rescinded. So the four instances that this law, or I should say regulation, passed the board are all listed here, and those are the timeline that Shar went over to explain in the beginning of her presentation. So this rescission covers the entire regulation, and it's comprehensive. So although the higher education element was already eliminated, it's included in this one just to be clear for the public that everything pertaining to this regulation is now off the books.
So this is the discussion period, and Ben, just for clarification for everybody, or maybe Shara can answer, the amendments that were essentially made to this regulation in August of 2022 and October of 2022, and then March of 9th of 2023 were essentially based on Shara's timeline. They were pieces of exempting or amending the regulation to kind of remove folks that were in the original regulation, correct?
That's correct. Yeah. So each amendment addressed a sort of a different population or a different, some of it was related to testing protocols for people with exemptions. And I can pull back up the timeline or those individual regulations if members would want, but that's essentially what we're doing is because they were each passed in sequence, just capturing them all here.
I think we have several questions. Dr. Ishmael? You guys see a hand up, Dr. Ishmael?
Yes, I support this amendment of this regulation or rescission of the regulation. I think that the risk benefit ratio for us in higher education, and though we have a clinic, is a lot of work to get everyone vaccinated, which is over 1,000 people. But the benefit of it is going to be lower now than it used to be during the 22, 23, and when it was passed. I think I'll leave it that optional for the individuals to get vaccinated rather than have the institution document and force everyone to get vaccinated.
Thank you. Do we have any other comments, questions?
I have a question, I guess more of a comment. I mean, I think it's important in terms of communication to be clear on why we're rescinding it. And so it's not that we don't believe in vaccines anymore, for example. It's that the situation has changed, the rates are much lower, et cetera. I think it would be, I don't know how that gets communicated, if this is part of the language of when it's rescinded, or if this is communicated in a different way, but I think it would be very important to make it clear that we still support vaccination.
We absolutely support vaccinations, and I believe Jim Garrow, our communications director, is on. If he's not, we're going to make sure that this is communicated appropriately, because right now we do not want anybody to get the wrong message. We support vaccinations. Vaccinations are very important for the well-being of everyone to have that immunity. So we definitely will, depending on the vote and the other comments of the board members, we will make sure that the communication strategy is very appropriate, so that the best message and the message that we want, which is the rates have decreased, that this is removing this is not, the message is not that we're not in support of vaccination. But Dr. Gold?
Wanted to lower my hand first. I also want to say, first of all, getting through the PTSD of talking about COVID, that I also support this. I totally strongly, as you know, agree with Dr. Diaz-Rue, the context in which we're functioning in the world of public health and medicine and evidence-based public health. It's critical that we're very clear in our communications about what this means. And then just to say, again, we talked a lot, thank you, Dr. Epstein, for the presentation about the outcomes of disease to the individual for vaccine. But there were really two reasons for the mandate at the time, right? One was for the health of healthcare workers and their being able to stay at the job and do what they needed to do and have good outcomes. And the other, and I don't know if we have any data on this, Shara, was to at least give some modicum of safety, which it turns out isn't really so, to people going into the hospital to not get COVID from their providers. That is, that in some way, the prevention of disease, number one, to not get it in the first place, wouldn't transmit. But number two, is there any data on transmission among vaccinated or hybrid infected vaccine and natural infection individuals in the healthcare setting? So do we have any data to that effect about transmissibility among vaccinated people in terms of severity of disease, contagion, et cetera?
So I did a lot of literature review before this, and there are a few studies looking at household transmission among people who have been vaccinated. One or two studies looking actually in confinement facilities of transmission among vaccinated people, and the results differ based on the study. I don't think there's very, very strong evidence. And I also think those are very different settings than the healthcare setting where you have, much shorter contact and more layers of hopefully protection and the ability to stay home when you're sick.
Yeah. Masking and air control are everything, right? I mean, we've said ventilation and masking are everything. Thank you.
Dr. McNeil?
Good evening, and thank you for this great presentation. And Commissioner, thank you for championing this, because this has been a concern of a lot of healthcare agencies as to whether they are violating law by not following this and being kind of in limbo. So thank you. I also had an earlier comment about communication, which has already been addressed. And then my other question maybe is for Ben. In terms of assuming that this resolution is approved this evening, does this go through the normal comment period, or is this immediately rescinded? I'm not sure how the process works.
Good question, Dr. McNeil. Yes, this would need the normal 30 days after it's passed through the Board of Health, because we're no longer in the emergency declaration.
Great, thank you.
We have, sorry, Dr. Below.
Yeah, thank you, and thank you for the presentation. Just one thing I wanted to mention is that I don't think we need, like, you've shown plenty of arguments, and I think everyone is expressing their opinions with this quite clearly. But I think it's also important to recognize that we now know more than we knew then, especially we know more about the transmission thing. Back then, it wasn't really clear, right? The first few studies on the vaccine were pretty clear. That I seem to remember the first Pfizer trials had a 95% protection against symptomatic infection, which I think a lot of people took as 95% protection against transmission, right, back then. And I think we now know that the main effects are in preventing severe disease, which I think for a mandate, it loses a lot of the public aspect of it. So recognizing that we know more, that's normal, I think is also important indeed. Not saying this should be part of the communication part of it, but I think it's a normal process, especially in emergencies. But now no more than we knew back then, and we correct a few things.
Thank you. Anybody else have a question, comment? Ben, is there something in the chat?
There is Nothing in the chat, but I will open the floor now for anybody who would like to make a public comment. I believe we lost the person whose name was member of the public throughout this meeting, but oh, there's somebody in the waiting room. 1 second. They were back. Good evening, member of the public. I'm sorry that we lost you there. You're back. It's now time for public comment. So if you'd like to make a statement, you can now, and I would ask that you keep your comment or question to 60 seconds. Thank you.
Hi, thank you. My comment is about Philly ACCT, which is experiencing a pneumonia outbreak. This is the only open intake shelter in the entire city, and it really operates on a shoestring budget. Only has an operating budget of $4.3 million and takes in 18,000 animals from dogfighting rings, negligence, criminal cases, strays. In comparison, San Diego County has a budget of $42 million and they take in the same amount of animals a year. Nobody from this committee appears to have visited this shelter, which is located in North Philly. I understand it's dangerous for a lot of you, but it is where it is located and where volunteers come every single day. Healthy animals are being euthanized because of this pneumonia outbreak, so they would be adopted, but they can't be. And basically, canine pneumonia develops from kennel cough. So it indicates how this facility doesn't have the resources it needs. So I'm going to have to ask that this committee looks into the Clean and Green Budget Initiative that just passed with millions of dollars. I think it's like $315 million, and get this shelter cleaned from top to bottom, pressure washing, bleach, that kind of thing. And then if I have any more time left, I do need to encourage you to work with the Pennsylvania Department of State regarding medical licensure in Philadelphia. There are doctors that have basically killed patients. I'm referring to a case 2349012389 about Dr. Catherine Secunda at UPenn HUP, who left a patient in the ICU to be noted as malnourished over 400 times during her 2 weeks in the UPenn HUP unit. And this was raised to the Pennsylvania Department of State, and they fought it and eventually found that there was no ongoing issue. And that should not be the, that shouldn't be the bar. It should be that, yeah.
Thank you
Okay,
very
you
much
wanna
for
hear
your
it. That's
for your
fine.
comment.
That's
No,
fine.
I appreciate you raising those issues, but thank you for your time.
Thank you very much, ma'am, and you should be comforted to know that I actually had an office at one point in the shelter that you're speaking of.
Okay, well, there isn't one now, so.
Okay. Yeah, Dr. Gold.
Yeah, I mean, I don't know if we want to take this up as a separate issue to the individual joining us. This outbreak or any nature of disease in the shelter has not been presented to this group before. And just to within the group, Commissioner, I'm not sure the purview of veterinary associated transmission of disease and the Philadelphia Board of Health. And I believe strongly in One Health principles and transmission, but I don't know where that falls in the city. And then lastly, while I appreciate the comment, there isn't anyone in this room, including myself, and anyone on the board who's not in this room who has ever made a decision in any way to visit or not visit the shelter based on its location. So this is, new information. I know we're not able to pick it up now as an agenda item, but I do think it's important, but I question purview in terms of, is there anything we need to know on an emergent basis? And is it our responsibility? That's it.
So just for clarity, Dr. Gold, and for everybody, that's at one point, the animal control shelter and animal care and control used to be under the purview of the Philadelphia Department of Public Health, but it's not been the case since 2010. And while animal health is essential and important, the entities that are involved will absolutely make that connection so that we can then address the complaint, and we'll definitely at least investigate and follow up accordingly. If it ends up being something that would involve the Board of Health, we will absolutely go ahead and bring it up as an agenda item for our August meeting. So with that, I'd like to make a motion to take a vote on the rescission of the regulation.
I'm not sure if you make the motion or,
I
um,
go for it.
I move to approve the motion as presented, as we all have it, for today's meeting on, as worded for rescinding that mandate of vaccination, COVID vaccination among healthcare workers, for all of the reasons that have been cited.
I'll second that motion.
Now it's my part. Sorry, I jumped the gun. You'll pardon me. Second meeting. All in favor?
I,
Aye.
Any opposition? Any abstentions? Okay, so the rescission of the regulation has passed the Board of Health. At this point, I want to just make mention, we will be meeting in August. Ben will send out the date. The date has already been sent out. Again, as I said at the beginning of the meeting, our division directors and our divisional leadership will be joining these meetings so that there's collaboration and an understanding of, all of the facets that the health department is involved in, so that there's an opportunity to get to know each other and work with each other further and more in detail. One of the items that will be on the horizon probably will be the board to promulgate regulations about mobile medical providers and the legislation that is being announced in City Council. And so we will have the capacity authority. It'll be similar to the outdoor feeding regulations so that we can go ahead and have the authority for permitting folks that should be able to take care of these activities. But I just wanted to kind of give a highlight that this may, depending on how the ordinance is announced and adopted, may end up with the board, because I want to make sure that if we have information that may impact the board, that I'm making you aware with. Dr. Gold.
Yeah, thank you for that. Just very briefly, I'm going to try it, which is, we've said this, some of us who have been the old timers on the board, I'm going to ask with grand respect that wherever possible, things promulgated that have to do with the public's health, that are promulgated by the Board of Health, are drivers from the board to City Council, as opposed to City Council being understandably whatever they're about on certain issues that affect the public's health, and then it's a situation of a tail wagging the dog, which I would, in all costs, like to avoid as much as possible, just so that we don't end up approving things because they've already been passed as law without input from those of us who are experts in this area, including, of course, the health department.
Absolutely. And with that point, and I appreciate that thoroughly, the ordinance itself would just say that the Board of Health would promulgate regulations. And so this board, that's the language we want. Yes, ma'am, I've learned. So that would be the statement. And then the board, keeping public health interest in mind, would be engaged along with Ben and others and the law department to promulgate such regulation.
That's fantastic. Thank you.
You're welcome. Anything else that anybody wants? No. So with that said, do we have any other agenda items or any items that anybody would like to bring up? Okay, so Dr. Epstein, thank you so much for the presentation, and Ben, thank you for all your work in organizing and getting this done. Division directors, Deputy Managing Director Gates, and Deputy Commissioners that are on. I do want to take a moment though, and if I can ask Ashley Clark to come off camera. Ashley Clark is our new, I believe you know Dr. Franklin, our Deputy Health Commissioner, and Sarah Ennis Thorpe, who is our Chief of Staff / Deputy Commissioner. Ashley Clark is our new fiscal Deputy Commissioner. And so Ashley, if you want to say hello, that'd be great. That way folks can get to know you. Oops.
I was trying to get I was trying to get off camera. Hi everyone. Nice to meet everyone. I'm Ashley Clark Jackson. I'm the new CFO Deputy Commissioner Public Health. I'm not new to the health department, but new to this position. So thank you for welcoming me, and nice to meet everyone.
Wonderful. Dr. Franklin, Sarah, Deputy Managing Director, does anybody have anything that they'd like to say before we potentially make a motion to adjourn the meeting?
No, I'm fine, thanks.
Same. Good evening, everybody. Thank you, Pallet.
Sarah?
Sorry, everybody. I'm at Girl Scout meeting and trying to come off camera at the same time. Nothing for me. Nice to see everybody. Thank you.
Thank you, Sarah, for double dutying mom and work. So, all right. With that said, do we have a motion to, and I apologize, division directors, if anybody wants to say anything, you're more than welcome to. I'll pause for a minute. Otherwise, we'll make a motion to adjourn. All right, hearing no one, do we have a motion?
No.
Second.
All in favor of adjourning the meeting?
Aye.
Wonderful. Thank you, everybody, for taking this time. Have a great evening, and the meeting is adjourned at 7:17 p.m.
Thank you. Have a good evening.
Thank you.
Thank you.
Bye.